Are you experiencing sciatica? It could be from a muscle problem called a Piriformis Syndrome, or it could be coming from a lumbar disc problem like a herniation or a bulge. In this video, we're going to learn if it is a Piriformis Syndrome, how to test for it, and also how to treat it by the end of this video. So how do we treat Piriformis Syndrome? A few things. We want to modify activities that might be provoking it or bothering it. If it's a basketball player doing a lot of repetitive motion, we may just adjust it, shut her down a little bit, maybe do some alternative activities that seem to be better tolerated, especially if she says, I can't do an hour practice. Maybe we ever do a modified practice. Maybe we just have her doing just shooting drills and things like that, not so much movement. Sometimes we have to shut people down. We say, listen, you got to give me a week or two for this to calm down before we start having you return to play or modified play. So first we got to establish, is there anything bothering it that would delay treatment? Because you can stretch these folks, and if you're still kind of doing the same activity for any condition, it may not make it feel better, all right? So you have to establish a good plan with that and good communication with the patient. Other things we look at is stretching or strengthening. Some people with conditions like this, they're very mobile, like their piriformis is stretched out. Like you have some people that just get incredible flexibility. And for those folks, you need more strengthening than stretching, okay? So we have some people with piriformis problem, we'll give them some light piriformis stretching, but the main thing is to get them stronger, having to do certain exercises that strengthen the piriformis, from Bulgarian split squats to some isolated strengthening like clamshells or other exercises like that. Other cases, we have someone that's very tight. We start with a lot of stretching, but eventually we progress to some form of strengthening as well. But there's two different camps. Sometimes people are very, very mobile. Stretching really isn't making the difference, as we want to get them stronger. But that's where the evaluation comes in, and those are where you'll pick up on those things, especially if they're getting some weakness in the hip girdle and such. It's something we want to address. But like I said, that's more common. Pronounced weakness related to nerve root problems is more common with the disc herniation problems. Okay, so what is a Piriformis Syndrome? Piriformis Syndrome is basically based on a muscle that's trapping or catching the sciatic nerve, okay? So nerves coming off the lower back. This yellow band right here is depicting the nerve. The muscle runs from the very edge of the sacrum here to the greater trochanteric region, okay? So if my hand was basically the muscle belly right here, this one right here, the nerve goes underneath my hand and goes down to the lower leg and provides sensation and a nerve supply to the lower leg for sensation, motor, and pain. Very similar to carpal tunnel in your wrist here. You have a tunnel which is right about here in your wrist. The median nerve goes through this tunnel through our wrist, and it provides sensation and motor to these regions right here, to our three fingers. It gets entrapped here. So it's just very similar to this entrapment. This one is by a muscle. This is more from the ligaments and some swelling within this tunnel. So there's a few things that can cause this, like we talked about. It can be a direct blow. You can fall onto your buttock, a direct impact, let's say if you're tackled right over to the piriformis, or like a motor vehicle accident. It can be done by repetitive activities, repetitive moving, stair climbing, running, even like lateral movements can overdevelop and cause this muscle to kind of get enlarged and compress something underneath it. The other part can be someone that drives a lot, sits a lot for prolonged periods. That can be definitely someone that is more susceptible to this problem. Some people with wallets, depending where the wallet is in the back pocket, that compression can cause some irritation to the muscle belly and create some problems. So this muscle functions as a hip abductor. It's going to bring your leg out to the side. So if I do abductors, you bring your leg out to the side, or it can be a hip external rotator. So rotator is rotating out like so. So those two motions. It really depends on if the hip is flexed. The hip is flexed, or if the hip is extended. They work differently in those two positions. Therefore, you'll find that we like to give people stretches both in both positions, when the hip is flexed and also when the hip is extended. So you'll find this condition more common in females than males. Typically around that 40 to 60 age range is commonly where you'll see it. More common, but it can occur in younger individuals. If you're either really sedentary, you're just not moving a lot, or you're doing more vigorous activities that require pivoting, turning, moving, or repetitive motions like biking and such, stair climbing can also elicit these symptoms as well. It's kind of like you can be on either end of the spectrum. So the symptoms you have typically are the location of symptoms are more And for Piriformis syndrome, are primarily at the buttock, typically on one side. Okay, lumbar disc problems, you can have symptoms on both sides. You typically have buttock and down. Piriformis can occasionally even refer down to the ankle or foot. I typically think about that as a disc issue. People that have disc herniations, bulges, or certain degeneration, they'll can have pain more in the lower back area, kind of above the waistline right here, in addition to buttock and pain radiating to the ankle. When I think of any kind of symptoms in the ankle and into the foot, typically I think of it's got to be a really bad piriformis, or I really look at more of a lumbar disc problem as really the origin of the problem in my experiences. So how do we know if we have a piriformis syndrome? There are several what they call special tests that are trying to cause a reproduction of the symptoms you're having. Okay, so that means if I'm taking you through this test, you'll say, hey, I'm experiencing the same symptoms that I had earlier. Now, these tests are a general guideline. You can also irritate other things in the back when you do certain piriformis tests. You can have false positive, which means you're getting a positive piriformis sign, meaning it sounds like you actually have this problem, when in actuality you have a disc problem, a sacroiliac problem, these joints right here. You could have a problem with the facet joints that are part of the lumbar spine, so you can give false positives. So use these tests kind of, it's part of the overall picture, and it shows there's a possibility of a piriformis syndrome, but not absolutely. Also, we look at, like we talked about earlier, certain people are more predisposed to it, so the history, like how it occurred, are they in the age range, are they female, or there's certain things we look for, and we say that there's a higher likelihood of that there's possibility that this is a piriformis problem. So this condition is, as the Cleveland Clinic has indicated, it's not as common as we think, like 0.3% to 0.6%. So we have to kind of look at this as that this probably is not as common as we think. So keep that in mind. If you're not also having success with treatment, it may be that you do not have a piriformis syndrome. So like we talked about, we looked at the lumbar spine. We also use the McKenzie template, or the McKenzie method, I should say, to kind of examine the lower lumbar spine. You should check on our other YouTube videos. We have Will the McKenzie method help my lower back pain. So look at that video and it'll explain a little bit about how we use it to look at the lower lumbar spine. So piriformis syndrome, like we talked about earlier, oftentimes it's much more with like sitting, excessive, let's say driving, or direct pressure on the area, where disc problems can be from like heavy lifting, forward bending. With disc problems also, a lot of times they really don't like to be in one position too long, especially sitting. So those are the two differences. I would say the bending forward is more, I think of more disc problems and things like that. You can have repetitive activities, like we were talking about lateral movements and stair climbing, that the piriformis can affect you. But not so much like the heavy lifting and such, those one-off events. I associate that with more like disc problems. That's some of the differences as far as things that kind of provoke it. So the compression of the sciatic nerve occurs in both piriformis. That's why they can look like sciatica. They can look very similar as far as sciatica symptoms, anything down the leg. The only difference is the piriformis muscle is compressing the sciatic nerve a little bit further away from the spinal cord. Where in the cases of a lumbar disc herniation, it's occurring, like this is an example of a herniation right here. This disc right here goes onto one of the nerve roots that make up the sciatic nerve. So that's the case where you'll get a different type of involvement. Disregard this piece of TheraBand here. But yeah, that's basically what we're talking about there. So yeah, it just matters where it's actually being compressed. It just further up the chain. In cases of weakness, weakness in the lower extremity, that means, typically down the leg, it'd be different parts. It could be your ability to lift your leg up or extend your foot, bring your toes up, or lift your heel. If you have weakness down there, it's more common with disc herniations. Piriformis, you can have some weakness, but it's typically more mild and more transient. With nerve root issues, depending on how long and how severe it is, it can be a lot more severe and more pronounced. You can get things like foot drop with the herniations. Really not the same thing with the piriformis syndrome, even though it's compressing, these nerve roots. So when we do a clinical exam, there's slight differences here. When we go ahead and compress, so this is the muscle belly, the piriformis belly, it goes from here to here. We press on, it's a little tender, especially as it's a little closer to the sacrum in this region right here. The lumbar spine, you'll get tenderness right along, sometimes the tips of the vertebrae or along the sides here, you'll find it's a little bit tender there. But I find piriformis typically you don't have tenderness in the lumbar spine, but occasionally with a lumbar disc problem, you will also have tenderness in the buttock region as well, even though the buttock isn't the origin of the problem. So I would say piriformis, you just have tenderness in this muscle belly. Lumbar spine, disc issues, you can have tenderness in the buttocks, okay, and also at the lumbar. Okay, so that's one of the differences as far as if you're poking around and just kind of self-assessing your back and buttock. That's a common difference. When you do an MRI, you do an MRI of the lumbar spine, piriformis region. Typically it's relatively negative in here. You don't see a lot of changes in the lumbar spine. Sometimes you have changes and it's still not the origin of the problem. You know, unfortunately we'll have MRIs that show disc problems, but the disc is not part of the problem. Even though you have a herniation or a bulge in the lumbar spine, it still could be a piriformis problem. In not all cases. So you got to consider that even though you have a positive finding on MRI here, you could still just be dealing with just a piriformis issue. That's why it's important to do the other tests and to do movement testing and also the history of what the patient tells you to really come down with a true kind of working diagnosis or PT diagnosis. Okay, so consider that. So what helps it out? I would say a combination of stretch and strengthening can help both conditions for the lumbar spine and for the piriformis. I will say that with the piriformis problem, unless you really aggressively stretch it, I haven't seen people get as much irritated by that, where if you stretch it incorrectly and you have a lumbar disc issue, I find you can really make the condition worse fast. So if you're dealing with piriformis and you start stretching on your own and testing it out, a lot less sensitive. If you have a really significant disc problem it's very highly irritable, okay, it's very sensitive, and you learn that from the history. If someone says, Tom, it hurts really easily, like only little things like that, we want to be a lot more careful on how we stretch these people if we have a lumbar disc problem. So if we mistreat it and we misdiagnose it, and we start cranking on the hip and really do a lot of aggressive stretching, it may actually make our lumbar disc problem a lot worse. So just keep in mind, one's a little bit more sensitive to doing stretches. Another complement is also gentle massage over the piriformis muscle belly. You gotta be careful. Occasionally this will aggravate it if it's really acute. It actually, because as you compress and massage the muscle bellies, you're also massaging that nerve root. Depending on where it is anatomically, you could actually push on that nerve root somewhat as you're doing, let's say, a really deep tissue massage. Sometimes that'll be too sensitive in the early stages. Something someone's had for a while, they can sometimes tolerate some really intense stretching. Depends on the person. Another thing, taking anti-inflammatories, if there's inflammation around the piriformis, especially if it's been a direct blow or something of that nature, sometimes an anti-inflammatory over the counter can help you out well, but you got to check with your doctor first. Talk to a physician about that, whether it's appropriate for you. You can Advil, Motrin, something of that nature, Aleve. Or if you need something more serious, sometimes you need something like a Medrol pack, which is an oral steroid. That's another potential thing you can take. And in some cases, even like a muscle relaxer if it's really in spasm and such. That's not as common as I've seen more the use of anti-inflammatories by physicians and recommending that to their patients. So lastly, occasionally they'll go in there surgically if there's significant scar tissue from like a real trauma, like we're talking a massive trauma, whether it be a motor vehicle accident, something that's really created a lot of scar tissue around that onto the nerve. They'll occasionally do a debridement where they kind of clean out that area right around the piriformis and release some of that tissue to just create some more space so that nerve can kind of essentially heal. I haven't seen it clinically here, but I've heard of cases where they've gone in when it's severe, and typically, like I said, much more of a trauma, significant event that has occurred. The first thing we're going to show you is a series of stretches, and then we're going to follow with a series of strengthening exercises. Even in the cases of people that are pretty mobile, I start with some basic stretches, at least the first session, and see how they tolerate those, and then I'll progress to the strengthening. If they're really tight, I may stay in the stretching phase for a little longer until we got pretty good mobility, and then eventually add strengthening. So there is differences depending on the person you are. You can take both your hands for this stretch. You want to bring it across your body and up, almost like you're going to the opposite shoulder. You can hold it for 1 or 2 seconds. Eventually you want to work to about 3 for 30 seconds. And we're going to be doing these 1 or 2 times a day for all the stretches I show. So across, release, and across like this. So we're stretching this side. The other stretch, we're going to come across. There's two different versions. One where you apply pressure like so, okay, and you're just supporting your knee. Another one, you can actually bring your leg up. This one is a little awkward if you have tightness in your hip generally, okay? So release, like I said, 2 or 3 seconds to 5 seconds, eventually moving to a 30-second stretch 3 times, okay? I would do both sides just to kind of even it out, and you want to do these stretches at least twice a day. You have to have pretty good mobility to start with this, meaning your tightness or restriction is probably not as significant in a pigeon pose. So you're going to bring your leg forward. This is the side we're stretching. Going forward, and the other leg comes down, okay? So you can see it's very similar to the other stretches, but you're using your body weight to come down on it. So you're going to lean forward. You should feel a lot of stretch in this right buttock area, chest forward like this. You can let it come down a little further if you want, but it's pretty intense stretch. You can even just do one, once you get comfortable with it, instead of 3 for 30, just hold it for about a minute, minute and a half. But I start out with short duration stretches. Lastly, if we're stretching this side, we lie face down. I'll actually do this type of stretch when I stretch people manually. I'll keep their legs together and then let the foot come out to the side to stretch. So we're stretching the muscle over on this side. Little pause, 1 or 2 seconds, and release. You just can't put as much force through it, so this one, sometimes it's good to have someone help you with it. So all the way out to the side, good stretch. Start out slow and then always add to it, okay? Okay, so when you're doing this, we're strengthening this side. I would do, like I said, I would do these on both sides. You can do a simple 3 sets of 10. Typically, these strengthening exercises I'll do 2 times a week, occasionally 3, but generally 2 times a week. Place your hand right at your waist level. Bring your knees apart like so. You want to make sure you don't roll your back, so keep this just curving from the hip. All the way up like so, and then back down, okay? Sometimes I'll add a little pause at the top for like 3 to 5 seconds, and then back down. And you can do this on both sides. If you're really weak, we'll have people do it on the back and just do both at the same time, or do individual, just do one side and then back in. But gravity's helping you, so it's typically an easier way of doing it. So I normally start out with a double bridge here, basically with both legs. Start with your hands, depending on your level of fitness. Hands at your side, lift your hips up and back down. Same idea, 2 or 3 sets of 10. You can also add a little hold at the top of the motion, okay? And then back down. A nice progression to this is to bring one leg up. So I want these done on both sides, but sometimes what I'd like to have you do is bring one leg up and then lift, okay? And then back down. To make it a little harder, you can extend your leg out a little further, and that should make it a little harder, okay? Eventually you can do with the weight bar across your waistline. Weight bar rests here, and you can do the same glute bridge both sides by adding a barbell here, but that's obviously more advanced. So I would first start with just body weight squats, and the second part is we're going to do Bulgarian split squats, okay? So body weight squats, we'll start with just we want to test it out. I don't know how sensitive this is for you at the particular moment. So I would start with body weight squats, do partial range of motion, then full range. You can place your hands like so, because eventually we're going to give you a weight in this position. We're going to drop our hips down, drive our knees forward. I would say hip over knees over feet, just like so. Good stretch in the buttock, and then back up. Okay, from a side view, just don't let the heels come up. Make sure your hips are going back and knees are going forward. So just like this, and back down like that. Okay, and finish the motion. Down and back. 3 sets of 10. Then you can turn it into more of a goblet squat. Hands like this with the dumbbell here. I mean, if you like to carry it, it doesn't really matter. Just make sure it's close to your chest. Okay, so we're doing the same movement pattern. Drop down and back up. All right, so I would start with squats. If you're tolerating the squats, like I said, we want to do 2 strengthening sessions. I kind of like doing a 2-day split in between, so 2 days off. So Monday, Tuesday for the strengthening, Tuesday, Wednesday, Thursday back on, okay? You always want to start with the clam exercises and the bridges first. The more advanced exercise would be then to do the Bulgarian split squats. Same idea, about 3 sets, 4 sets of 10. So depending on the side you're working, I would do it on both. Okay, well, the first part is, let's say we're working on this side. I like to have the rear leg back like this on the ball of your foot, that can be feeling a little bit off balance. If you have to, you can actually rotate your foot out slightly like so, if you need to, okay? And put the other foot forward, okay? So you're gonna come down, little support if you need it, drop down, and back up. For the sake of this exercise, I either keep you more vertical if we're trying to look more quads. If we want to get more glutes, is what we're trying to strengthen, I'll let your body come forward more like this. So you're doing that and back up. So you're that little bit of that forward lean. You're going to get more of a stretch and more of a contraction in the quads. Excuse me, the gluteals here, sorry. And forward like that. Another thing to do is offset a little bit. So this is a little bit off from your leg. So the straight leg right here, bring your foot back a little bit. All right? So down and back up.